Hey guys, I'm excited today. I have my friend Dr. Russ Kennedy here. It's called the Anxiety MD. I met him at a energy training retreat with Paul Walker, who I had on the podcast earlier, and it was really great. And we had some good conversations. And yeah, I'm just excited to have him on here today to talk about anxiety. You want to introduce yourself a little bit more?
Sure. Yeah, my name is Russ Kennedy. I'm a medical doctor and neuroscientist. I grew up with a father who had schizophrenia, so I had a lot of chaos in my childhood, created a lot of anxiety in me, went through 20, 30 years of different therapies, none of them worked, so I basically had to find something that worked for me. So that's the short version.
Yeah. What kind of doctor were you?
I just did general medical stuff. So when I finished, I worked emergency, I delivered babies, worked in an urgent care clinic, that kind of thing.
Mm-hmm. Okay. And so what about that did you find that what was lacking in the medical field
I think it's just, basically it's highly pharmaceutically based. So, there's a medication there for everything. That's how we're trained, is to use a medication most of the time. Now, it helps with symptoms, but if your underlying cause of your arthritis or your Crohn's disease or whatever is trauma that's unresolved, that's still stuck inside of you, it doesn't really do much for that. So I think medical doctors are amazing in many, many respects, and I think medications are very helpful and also in many respects. But I think that they're overused, and I think it kind of dangles patients over the gates of hell in a way, because it numbs their symptoms so that they don't actually have to deal with the underlying problem.
Right. So they're dealing with symptoms a lot of times rather than the root causes. So it's not a long-term solution.
Yeah. Exactly.
You said you're a neuroscientist as well?
Yeah. My first degree, my pre-med degree, was in neuroscience.
Awesome. So how do you feel about neuroscience and how that interacts with those beliefs?
Well, I think it's pretty amazing stuff. People really like to know the pathways in the brain that create, the amygdala, the hippocampus, basal ganglia, prefrontal cortex. People love knowing that this is what's happening inside of their mind. Doesn't really help us heal, though. That's the thing about science, is it gives us coping strategies, but really healing is much more of a kind of a spiritual nature. And I believe that anxiety is typically a mind-body disconnect, which is why exercise and yoga and that kind of stuff helps, along with an adult self, child self disconnect. So I believe that there's a child inside of us that is asking for our attention through this alarm in our body, and the adult doesn't want to go back and visit the child because the child holds their pain, and the child doesn't trust the adult because we've been there with them 10, 20, 30, 40, 50 years sometimes and haven't really gone back to say, hey, are you okay? Is there something I can do for you? Can I help you? And then we start looking for things outside of us to heal us. People, putting a lot of pressure on our partners or our kids even to look after our emotional needs. And that's valid to some extent, but if you don't give it to yourself, you're always going to be lacking. Nothing that anyone gives you from the outside is going to be enough. You need a combination of both. So you need a combination of, connection with other people and connection to yourself. And you need a combination of, combining your mind and your body together, and within your own self, combining that adult self with the child that's still in there. Yeah,
that's all great. I think psychology call that like parts work. And I'm a big fan of that. And yeah, like you said, it's great to have other people and then model what love and validation, all that stuff looks like. But if our own mind and our own body isn't feeling that, we have to believe it ourselves. And that's a process and something that we have to work on ourselves. And so if we're always looking for other people to fill that, that's only part of the process. It's not going to make that long-lasting root change.
But it does feel good to get validation from other people. So I think that's why a lot of people who are actors and people who seek out the limelight, often they didn't get enough attention as children, and they're seeking it out that way. And I think the reason why they get so disenfranchised with being famous is that it's not what they thought it was going to be. They thought it was they thought it was going to provide them with all this love and connection, maybe not consciously, but unconsciously. And then when they find out, no, you're just a commodity, you're just an article to them, it's very hard on the ego. So
Yeah.
I see that's why a lot of people who are, highly successful in the public eye are also highly distressed emotionally.
Mm-hmm.
They don't show it. It
Mm-hmm.
looks like they've got the best life in the world, but internally it's not true.
Yeah. Well, also, I mean, I think it creates this disconnect with themselves because they're like, oh, I have to act this certain way that people like that. That's when they'll validate me and give me love. And so it's like, but then they're like, oh, who actually am I? I'm not this character I'm playing or this role that I'm being for the public for this love, like whether that's conscious or unconscious. And then they're like, oh, I can't actually be who I really am, and so it's more disconnecting with themselves and that child part of themselves, and so in the end they find that it's empty.
Yeah, I mean that's Jim Carrey. I mean basically that's what he found, that no matter how famous I got, it wasn't going to fill this sort of
Mm-hmm.
lack that was inside of me. And because he was so good at what he did, that people would just love him so much. Robin Williams to some extent, same kind of thing,
Mm-hmm.
So at least Jim found this sort of internal strength inside of him and decided, hey, I don't need this persona anymore. I can actually be who I am. And he's in a, I think he's in a much better place than he was before, for sure.
Mm-hmm. Yeah. I've watched some clips and I thought he's had some good stuff. I think I think in your early stages of changing, you get kind of self-righteous a little bit, and I kind of see some of that. But I think that as you heal, that calms down in time, and you can just appreciate who you are without needing to be so self-righteous.
Yeah. Yeah. And I think, when you find something that works really well for you, sometimes people make the mistake of extrapolating that that's going to work really well for everyone.
Right. Mm-hmm.
Now, I think Jim's insights are for everyone. But,
Mm-hmm.
Initially, when you first start seeing the light and you start seeing progress, it's like, oh my God, this is the best thing in the world.
Mm-hmm.
So you want to
Yep.
share it with people. So,
Mm-hmm.
I can understand where he comes from, for sure.
Right. Yeah. I've been there myself.
Yeah.
So I get it. So how did you transition to becoming the anxiety MD? Anxiety is something you dealt with in your life as
Yeah.
well?
Yeah. So from med school in my 20s, it was there was a lot of anxiety about med school. Do I have the brains to make it through? Do I have the stamina to make it through? And how much of that did I put into my identity? Like being a doctor was a huge part of my identity. And not being a doctor, like withdrawing from med school or whatever, would have been devastating for me. So, it created this huge rift inside of me. Is like, oh, well, this is what you have to do. And the other part of me was like, do I really want to do this? And I really loved, of course, helping people and that kind of thing. I've always been kind of empathic and helpful to people. And that kind of filled that role quite neatly. But as we said earlier, it wound up being just handing out prescriptions to people and not really getting at the root cause of anything.
Mm-hmm.
And again, I'm not against medical doctors. I think there's a huge role for providing symptom relief for people, just provided that we know that that's what we're doing. And if somebody presents to your office as a doctor with these complex symptoms, like think trauma, think childhood trauma, and refer them out to someone who does maybe parts work, IFS, or somatic experiencing or something like that would actually help them in the long term. Because we as doctors get 7 to 10 minutes with every patient. And if somebody's got a severe, background trauma, we're not going to be able to touch that because A, we don't have time, and B, we're not trained in it at all.
Right. Yeah. And IFS is internal family systems, right?
Yep.
Yeah. Yeah. I remember in grad school as well, feeling a lot of imposter syndrome and a lot of anxiety. I think, you grow up and, might be smarter than the average Joe and feel pretty good. And then you get to grad school and you realize everybody's really smart too. And
same with med school. Same,
Yeah.
we're all like straight A university students. So it is one of those things that it can be kind of intimidating.
Right. Mm-hmm. Did you deal with anxiety from a younger age as well, like from childhood?
I think so. When I look back, and see that, I was kind of a nervous kid. I was always really sensitive. There's this great saying that I love. It's like the drama and trauma of a family will land squarely in the heart of its most sensitive child.
Ooh.
So, if you're the most sensitive child in your family, there's a good chance that you absorbed a lot of that familial trauma.
Ooh, I feel
I
that.
talked yesterday with a woman who is Jewish, and her parents, were in the Holocaust and that kind of thing. And just the trauma that gets handed down through the Jewish faith, but, through African American, like there's all this trauma that we don't acknowledge that's handed down that sort of weighs people down. Yeah. And it weighs people down. So it's this trauma is multifactorial. I've even had people with, severe anxiety who said, my parents were amazing. My parents were great. But then I say, well, go and ask your mother if you had a separation from from her or her dad or your dad before the age of 5, because 80% of your brain development occurs before 5 years old. And so many people come back and say, oh, I didn't know this, but for a month, I had croup and I was in the hospital, and then the parents weren't allowed to visit me, because there was one time where the hospitals didn't like parents visiting their children, because when the parents left, the children would just freak out and become unruly. So what the hospitals did was they said, okay, no more parents, no more parents visiting. So of course the kids would all go into, dorsal vagal shutdown. They would all go into like complete withdrawal, complete collapse, which is very anxiety provoking. So I see quite a few people that had good parents, but because they had that early separation typically from mom, they really had a hard time with abandonment and anxiety.
Yeah. My mom said that she took me to preschool, or it was daycare one day, and I just hated it. It was terrible, and she took me out.
Yeah. And you were probably born a sensitive kid.
Yeah, so I definitely was very sensitive. Do you think it has anything to do with the whether you're like the oldest or youngest or middle child or things like that?
I kind of think, when I see people in my work, the oldest child of that sex tends to pick up the parents' issues. So the oldest boy will pick up the dads, the oldest girl will pick up the moms. That's a general rule. Like it's not always true, but I see that quite frequently, as the oldest child picks up the trauma and drama of their same-sex parent.
Yeah, I was the oldest. Yeah. What about you?
Well, my dad was schizophrenic, and he had a lot of trauma. My dad was born in 1934, and he weighed under 2 pounds, and he survived. My grandmother said we took him home in a shoebox, and the doctor said, we don't expect him to survive, but he did. And that's the reason I'm here. So it's really interesting to see. But he had a lot, prenatal trauma and all this stuff that sort of came out. And eventually, that energy kind of weighed him down psychologically, because we don't have a history in our family of schizophrenia. So I think it was just the trauma of, being born in 1934, where there's no neonatal ICUs. There's none of that stuff, and just sort of making it through. So I think he started off life physically kind of debilitated. He grew into a fairly good athlete and that kind of thing, but he had a tough start for sure.
Yeah, I've heard that even just like being born in a hospital and everything going on, like that's traumatic for babies. So it's like we all have a certain amount of trauma.
We all do, and I think that's true, Kenal. But I think too, you can't have childhood without trauma. It just doesn't happen. But if you have attuned, attached caregivers that can kind of mediate that trauma and resolve it at the time it happens, your nervous system actually becomes stronger than someone who didn't have a lot of trauma and never really got tested. Right. So if you have trauma as a child and you have really attuned, attached, loving parents, you can actually develop a stronger nervous system than those people that had sort of, cushy childhoods with not a lot of trauma. Right. So, I think we need to be tested, and it's the repair part that really allows us to learn.
Yeah. You could see it just like lifting weights, it's good to tear your muscles and build up, but you don't kill yourself. You build up, and also you got to recover and, for yourself healthy and stuff like that. So,
and healing is the same. Healing is the same. So it takes a while. Like people come and say, I see these things on, Instagram or whatever, heal your anxiety in 7 days, heal your anxiety in a month. It's like, well, it probably took 10, 20, 30 years to develop anxiety. You're not going to erase those programs in 7 days. Right. So, we can make you feel better by thinking better, sure, but it's not going to resolve the underlying problem.
Mm-hmm.
So it's just like, it'd be like, I'm going to teach you how to be a guitar virtuoso in 2 days. Just, the brain needs time to wire and unwire, rewire, override a lot of these old programs that we assume were for our survival.
Mm-hmm.
Hypervigilance, OCD, all these things are survival-based mechanisms.
Mm-hmm.
And it takes a while before we feel safe enough in our environment to be able to kind of start rewiring those old programs.
Mm-hmm. So you said it takes like 20, 30 years to develop anxiety. Can you explain more what that means?
Well, I think, people have had, by the time they see me, typically, most of my clients are female, like 60, 70% female. Most of them are probably somewhere between 35 and 55. So, they've had trauma that, they endured when they were like 8, 10, 12, 15 years old. So it's been in there for 20 or 30 years. So we're not going to, erase those programs or rewire those programs in a week. So it's learning how to connect, your adult self with your wounded child self and your mind and your body. And then you develop this sense of safety. And in this sense of safety, then you can heal and those old programs kind of rewire themselves. But if you don't have any safety, you can't really heal any sort of emotional illness, depression, anxiety, OCD, eating disorders, personality disorders. You can't, unless you have safety, you can't heal any of those things.
Right. Yeah, you need you need a good feeling to try to bring in more, to know your body has to know what that is before it can accept that more and bring that in. Would that be correct? Yeah.
Yeah.
So you said you have mostly female patients. What is the correlate difference between male, female as far as like anxiety?
Well, I think it presents in slightly different ways because men tend to push the emotion away.
Mm-hmm.
So men are much likely to use alcohol, to use illicit drugs. Females are much more likely to use prescription medications. So it's kind of a different animal. The trauma is often the same, but it's the way our society and we're wired is different as male and female. Male, it's like, well, everything's up to me. I don't rely on anyone else to help me. Women are much more collaborative in that respect. So healing is often a different structure for women than men. So it really comes down to how well can you be vulnerable? How well can you connect with that younger, vulnerable part of you that's still inside you? Men typically have a harder time because they judge themselves pretty harshly. So do women, though, depending on what they were modeled by their parents. If you had parents that were very demanding or critical, you'll develop that demanding, critical inner voice too, and that makes it harder to heal because you can't feel safety.
Right. So you feel like that you have a lot more women coming to you because women are more wired to, or it's accepted in society to be collaborative and that it's okay to be.
I think that's true. I think that's true. And with men, there's a bigger stigma for men than there is for women. And women like to talk more than men do. Right. That's just part of the game. It's like women like to talk more than men do. They're more communicative. They know more words. They know more emotion words. So it's I think on some level easier for women to access that.
And so emotional intelligence is more taught to women, or
I think they just come by it naturally. I think they just come by communication. That's part of their makeup as females. Now, this is a generalization, of course, but as females, part of their makeup is to communicate, is to be more language oriented than men. So it's been shown that women know more emotion words than men do. And it resonates with them more than men. So our men are really good, if that's the word, at stuffing things down.
Right.
It's an ironic sort of paradox that we're good at stuffing things down, and so good, in fact, that our suicide rate is 4 times that of women. So. And one of the things about that is tears, having the ability to have tears or cry is basically a reparative thing in the brain. Your brain repairs when you can cry. But if you can't cry as a male, if that's been beaten out of you, essentially, emotionally or physically or whatever, or shamed, you're losing a real important part of healing. Just like sleep is, you prevent people from sleeping, they're going to get mentally dysregulated. If you don't allow people to have tears, they're also going to get mentally dysregulated, because that's one of the brain's most natural ways of combating stress and anxiety is tears, because you don't change the external environment. Your wife is still leaving you, or your dog has still died, but there's just something about tears that change your perception of the world to a more softer place. And if you can't have that as a male, life's going to be pretty hard.
Yeah. I always consider myself more of an emotional male, and I love reading and cry in books or movies or whatever. And I've always found it very, very healing. I guess the only thing.
One more thing before we leave that.
Yeah.
You don't have to cry in front of your girlfriend. You don't have to cry in front of anybody, right? It's just like I have a lot of guys that I say, okay, go car screaming. Like if you're really frustrated, go in the car,
right?
Go to a park or whatever, roll up the windows and just start screaming. And it's amazing how often when you start releasing that energy, that tears will come up, because they've been suppressed for so long. So you can have tears, but no one has to know.
Right.
Like initially. No one has to know. And that, I think that's empowering for a lot of men. It's just knowing that you can have some tears, but just do it on your own.
Yeah.
And I'm not shaming men, like not saying you can't do it, but there's a real barrier for men for tears. And if you can start making it a little more accessible, even if you're in the middle of the forest when no one can see you or hear you or whatever, it's an amazing release that we have as human beings. And if you don't allow yourself to have that as a male, things are going to build up. Things are going to get worse, and you're going to be more likely to lean on alcohol, porn, your girlfriend. We put a tremendous amount of stress on our wives and girlfriends because, we can't trust our male friends with these emotions because we won't share them that way. So as a result, all of that negativity gets channeled into our female relationships typically, which is a tremendous burden for them because they're already dealing with their own shit.
Right.
Yeah.
I won't get too off track, but I guess I know there was been points where I was so stuck on melancholy that I feel like there can be an overuse of tears.
Yeah. I think it's when it's happening too much, and you're not able to get out of that.
You get stuck in that emotion.
Yeah. But there's something about having tears about how you were treated. Like if you were emotionally, physically, or sexually abused, tears are really important to process that kind of stuff. So, I think that if you're caught in like depression, that's kind of a different story. But if you're frustrated and kicking the dog and slamming your car door and getting freaked out about everything and irritable all the time, chances are there's an emotional root to that. And one of the ways that we can metabolize that is through tears. There's other ways too. I'm not saying that you just have to become a tearful mess. I'm just saying, like, don't block that avenue of therapy for yourself.
Yeah, that's great. Maybe the first thing I should have asked, can you define anxiety?
Well, the way I define anxiety is anxious thoughts, and anxious thoughts themselves aren't painful. What's painful is this alarm energy that's in our body, and that alarm energy gets stuck there when we experience trauma as a child: emotional, physical, sexual abuse, loss, abandonment, rejection, bullying, anything that made us mature too early, or anything that shames us. So any of those things create this energy of alarm in our body. And there's this process in polyvagal theory called interoception. And interoception is how the brain detects the body. The brain is always reading the body. So if you have this old alarm from, being beaten by your dad, or the fact that your mother was a narcissist and you were never happy, or she was never happy, that's still in you. And basically what anxiety is the psychological manifestation of this old alarm energy that's stored in your body. So it's not anxiety is not really a mind problem. It's reflected by the mind.
Mm-hmm.
And because we worship the mind in our society, we think the mind is the cause of anxiety. Whereas the thoughts and worries, they're just a byproduct of this old energy that's stored in your body and your mind too. You can't separate the mind and the body.
Mm-hmm.
But it's this old alarm energy from your old traumas that was never resolved that keeps reverberating through your thoughts. And then when you come up with these horrible, worrisome thoughts, that alarm that's in your body gets more energized. And then it creates more thoughts, creates more worries, which creates more alarm, which creates more worries. And you get into this alarm anxiety cycle.
Mm-hmm.
So what I say to people is anxiety is just basically your anxious thoughts. And one of the ways that I sort of highlight that is I say I have two 15-year-old patients in my office, a male and a female. And I go in and I say to the female, Jennifer, I think you might be pregnant. Now her body's going to freak out. It's just going to lose her mind, right? I mean, if she doesn't want to be pregnant.
Right.
But and I go in and say, hey, Jake, you might be pregnant. He's just going to laugh. It's not going to affect his body at all, right? So it's the belief in what we're telling ourselves that creates the alarm in our body. And it's the alarm in our body that we perceive as painful. So it's not really the thoughts of our mind. It's kind of an illusion. The thoughts of our mind, we can point back to and go, I'm having this pain because I'm worried about this medical test or this biopsy or whatever, but it's not. It's actually this old alarm that's in your body. That's what you're feeling. That's what's painful. The thoughts are just a byproduct of that. So most therapies address the thoughts and they think, okay, well, we'll change the thoughts and that'll change the anxiety. And in the short term, that works. CBT, that sort of stuff works. But it doesn't last. You know, my wife is a somatic trauma therapist, Cynthia, and she said something the other day that really stuck with me. It's like somatic therapy, like somatic experiencing and internal family systems to some extent. They help, but it takes a while. It takes a while to create that foundation in the body. Whereas CBT and psychotherapy appear to help right away, but it doesn't stick. The somatic therapy sticks, but it takes longer to achieve it. And then I think when we get the somatic therapy in place, when we start grounding in our body, then the cognitive therapy has a place to root and actually stick and actually help us in the long term. But just trying to change your thoughts to heal your anxiety just doesn't work.
Right. Because a lot of times I guess I always thought like psychotherapy is better in CBT because it's actually addressing root trauma.
Is it though? Is it? Like, that's what I'm saying. Like, you can say, oh, yeah, my dad used to beat me when I didn't, but not for me. But my dad used to beat me from the time I was 7 till I was 12 because I have a patient like that. And it says, but it made me tough. It made me strong. Like, it made me not be able to say no. It's like kids are able to rationalize just about everything.
Right.
So, psychotherapy, if you're not actually getting into drilling down into the feeling in the body and sitting with that feeling in the body and acclimatize to it. And that's the basis of The Body Keeps the Score. Bessel van der Kolk's like seminal work is that we're not teaching people how to get rid of their anxiety. What we're teaching them how to do is acclimatize to that alarm feeling so that they can actually sit with it and stay with it rather than running up into their thoughts all the time. Because if the problem is down here in your chest and all you do is try and fix it up here in your brain,
right,
this problem in your chest never gets dealt with. Every time you approach it, you just go into your head. So it's like you never actually deal with the underlying problem. So that's my issue with psychotherapy.
Right.
Is if as long as you're getting into the body with that, and not just how do you feel? How do you feel in your body when you think your mother never loved you? It's like where is it? Where is it in your chest? Is it in your belly? Is it in your throat? Does it have a color? Does it have a shape? Is it a pressure? Is it a pain? Is it superficial? Is it deep? Go into the real nuts and bolts of it. Because if we look at neuroscience, there's a part of our brain called the insula. And the insula kind of mediates the mind and the body, kind of joins the mind with the body and the body with the mind. And I think the insula actually holds a lot of our trauma that appears to be in our body, but is actually in our mind. And if we can modify that feeling state, we can start changing the root cause of anxiety. So that's why I think psychotherapy, unless you're drilling deeply into the body, isn't really that effective in the long term.
Is EMDR a somatic technique that
some people, yeah, but again, it's really about, if we're doing drill into it, it's really about finding that younger version of you, right? finding that child in you, seeing their eyes, connecting with them, showing that they're seen, heard, loved, and protected. That's really what healing is all about. So EMDR is helpful. Typically, the research shows that it's more helpful for specific events, like a car accident or an assault, than it is like if you had an alcoholic father who was abusive to you, ever since you were a child. EMDR doesn't really tend to help with that long term. It may help with the symptoms, and it may temporarily distract you cognitively, which is one of the reasons I think EMDR appears to help. But in the long term, the only therapies that really heal you are the ones that allow you to connect with that younger version of you. Now, some people have such severe traumas, emotional, physical, sexual, that you can't do this on your own. You need a therapist. You need someone that can kind of see you through it. So that's the juggling act, is like how sensitive were you and how much trauma did you have? So you can be very, very sensitive and have relatively little trauma and still suffer a great deal from it. You can be not that sensitive and experience, the death of a parent. And as long as you get love and support, be fine with it. So it's a real balancing act, finding out the combination of how sensitive someone is and how much trauma they had.
That's a good point. I think so many people that have not been that educated in psychology or emotional, they are just like, they're treating everybody as equal. And also I think the realization that as young kids, things are a lot more like I'll go back and I'll watch a kid's movie. And then when I was a kid, I was like, it was scary music. That was very scary to me. But now I'm like, oh, that's nothing. But I was a kid back then. So basically things are a lot more dramatic. And again, that psychological development, and we didn't have that. We haven't developed in our brain to understand that everything wasn't because of us. It wasn't our fault.
Right. Yeah. And we feel more as kids. We're more in the moment as kids, And I think that's one of the reasons why, if you tell a kid it's going to be a week, it just feels like frickin' forever.
Right.
Whereas if you say to you, it's like, well, it's going to be a week. It's like, I know a week's going to pass actually fairly quickly. I think kids are more in their bodies. They feel more. Right. So they don't have that cognitive bypass where they can go into their brain so much and start, sort of metabolizing some of this pain through their thoughts. I think they learn that, I think that's where worry starts, is that the kids go into their mind when they're in a trauma that they can't escape. If you have a mother who's, constantly on you about your weight or whatever, like that's a trauma that they can't escape because they're kids. So they go into their heads, they go into the worry part of their heads, and they leave their body. And I think that's one of the reasons too, I think why people feel like as we get older, time goes by much faster, is because we're spending it mostly in our heads. We're not really actually spending it in our bodies.
Yeah. And I mean, you can even go more dramatic. Babies. I read this. It was really interesting that, babies are why they cry so much. And so they don't understand. Oh, I'm hungry. Oh, I have a poopy diaper, whatever, pain, hunger. Those things seem infinite to them because they don't understand that they'll get relief in this certain amount of time. So it's just end of the world.
And that's why it's so important to have an attuned mother that can see you, because if you have a poopy diaper or you are hungry and you're left for too long and that's not resolved, children, infants, babies start developing this thing that the world isn't a safe place. When you get an attuned mother and you feel pain and you get soothed, your brain, your unconscious brain, the deeper subcortical parts of your brain start feeling like, oh, okay, the world is a safe place. I am okay. And many of us who didn't get that feel that the world is not safe forever. And we live in this sort of survival mode. We can have periods where we feel comfortable and calm, but in general, it's mostly fear with islands of safety rather than mostly safety with islands of fear.
Right. So one thing I think about, you think that as our society's, becoming more psychologically aware and trained, although of course there's the opposite, making things, like TikTok pop psychology and you get misconstruing things. But there's a danger in like, oh man, all these things create trauma for kids. So I'm just not going to, I'm getting anxiety about having kids and being there for them the way I need to. How do you address that?
Well, it kind of depends on how emotionally balanced you are as a parent, right? Like some people have kids because they think that's the only thing that's going to truly love them, which is a kind of a very precarious place to
Right.
go.
Mm-hmm.
And,
See, so
TikTok.
see some like
Yeah.
women have like 13, 14 kids, and you're like, I mean,
Yeah,
it's
it's hard to tell
possible,
what the,
but
yeah, it's hard to tell what the, the motivation behind having those many kids is. It's probably external more than internal, but
Mhm.
it can be, but we live in this sort of dopamine driven society where we are in our heads. We are getting sort of, TikTok and Instagram, and, you can visit 14 beautiful places inside of 30 seconds on Instagram,
Mhm. Mhm.
so normal human experience can't even compete with that. So
Mhm.
we're developing this sort of totally dopamine driven immediate gratification society,
Right.
which kind of X's us out of maybe the serotonin driven sunset where you're just happy to
Mhm.
be alive and happy to be
Right.
there and witnessing that. There's less
Mhm.
and less of that sort of contentment part of being human. And there is
Mm.
this sort of, oh, what am I going to do tomorrow? What am I going to do now? What's
Mhm.
happening? I'm going to go and zombie scroll Instagram for a while. It's a very, we're being seduced into the deeper part of our nature in that we like novelty, we like new
Mhm.
things,
Mhm.
but we're burning out our dopamine circuits because we're always getting new stuff. So the bar keeps getting raised higher and higher and higher.
Mm.
The downside of that is if you look below, we're getting less and less able to enjoy the quieter moments,
Mhm.
so, and that's kind of where a lot of our creativity comes from, is
Mhm.
being quiet, being still, even being bored
Right.
is boredom is the mother of creativity. You've got
Right.
to do something as a child.
Mhm.
If you're bored, you got to do something. But the kids nowadays, I sound like an old man. These kids nowadays, it's like, but the kids nowadays, there's no boredom because all you
Mhm.
have to do if you feel bored is just go on your smartphone and just
Mhm.
start, Snapchatting your friends or whatever.
Mhm.
There's no creativity anymore.
Mhm.
There's no boredom anymore, is what I should say.
Right.
And as boredom leads to creativity, and boredom also leads to, how do I deal with negative emotion?
Mm.
Can I sit with the discomfort of boredom? Can I deal with it? But if you never actually have to deal with discomfort, because every time you feel jealous, envy, pain, you just zombie scroll Instagram, you're never really learning how to teach yourself that, negative emotion passes.
Mhm.
We can deal with it. So we have a lot of kids now who have a hard time with dealing with any kind of negative emotion at all.
Mhm.
So they're going on stage and going, and I'm not judging this. It's an observation.
Right.
I'm a highly sensitive person. So there's people that are smoking in the back of the room, and that's disrespectful to me. And it's like, we're not teaching our kids how to be resilient.
Mhm.
We're teaching them how to complain,
Mm.
actually.
Mhm.
Now, I know that sounds harsh, and I'm not blaming the kids in a way, because
Right.
they grew up in this society where
Mhm.
they didn't feel pain. They didn't have to deal with it.
Mhm.
But, now life is inherently painful. It
Right.
really is. And if you can't handle pain, life is going to be very, very uncomfortable for you.
Mm. Yeah. Yeah, that's all good stuff. Do you also think, with social media and the news and all that, we're aware of so much more of the world and the problems in the world, and also, of
Sure.
course, news is all about the negative, that it puts
Of
us
course.
more in this fight or flight response and overwhelm of what's all going on, and it's just like too much to process.
Yeah, absolutely. Without a doubt.
Yeah. So you want to talk a little bit about your program and how you deal with anxiety? How do you treat that?
Yeah, I wrote a book called Anxiety RX, and I self-published it. And most self-published books sell less than 200 copies. And as of today, it's just under 60,000 copies that have
Wow,
been sold
that's
of
amazing.
Anxiety RX. So yeah, this book right here is doing extremely well. I also have a program called Your Mind Body Prescription for Permanent Anxiety Healing, and that's just an online program. And I have a bit of an issue with the expense of trauma healing. So, people charging thousands of dollars for programs. I made mine $100. Or if you want to pay it in 2 installments of 50 once a month, that's fine with me. I wanted to get the information out there that there is a different way of looking at anxiety. There's a different way of healing anxiety. And the traditional models simply aren't working long term. So I created a program that has some meditation in it. It has something called the yoga nidra, which basically puts you into this relaxed state, connects your mind and your body, and also connects your adult self with your child self, which is what I believe, creates anxiety in the first place. Separation of mind from body, separation of adult within you with the child in you. So it helps you understand that anxiety actually is more to do with old energy stored in your body than it is the thoughts of your mind. And once people understand that, I get messages every single day from people that say, this is the first time someone's explained my anxiety to me in something that makes sense to me, and not just said, hey, all you have to do is think better. Just think better and your anxiety will be gone.
Right.
And for 0.4 seconds, that actually works neurologically. If you think better, you create a little dopamine and it does help you. But in the long term, it doesn't. And it's very difficult to think in opposition to how your body feels. If your body feels alarmed, your thoughts are going to be alarming. It's just the way we are wired as human beings. So it's understanding that you don't necessarily have to add a whole bunch of thoughts to this alarm feeling in your body. And can you go back and find that alarm, find that child, and see them, hear them, love them, protect them, show them they're okay. And that's how you heal anxiety at its root. So I made both of these things. The book is like $20. I think the program is $100. Because it's really important to get the right information out there. And once you know what to do, all it is practice after that. You just practice it over and over again, and then you start rewiring those old circuits that are in the subcortical region of your brain that are lower down, that are running your life. You can start rewiring them so that you can actually look at things and you can handle negative emotion. Your brain doesn't have to freak out every time you feel anxious. You can kind of go, okay, where is this in my body? Can I center into it? Can I allow myself to feel it? And then when you allow yourself to feel it, you've got to feel it to heal it kind of thing. If you allow yourself to feel it and say, this hurts, but it's not nearly the monster it was when I was 7 years old, then you can start metabolizing it. Then you can start to truly heal the root cause rather than just try to fix the thoughts, which, like I said, most therapies try and do. And there's nothing wrong with fixing thoughts, but unless you have a grounding in your body first, there's nothing for those new learnings to stick to.
Yeah, well, that's great. So again, just what you said. So I know that thinking about things differently, that's not the root, and that's comes after. But in the after, I've heard that like the feeling of anxiety is the same feeling as excitement. And so if you could kind of train your brain to be like, oh, I'm feeling excited. Is that helpful?
I think for some people it helps to understand that, when we are anxious people, and I use that term kind of sparingly, that anything that revs up our nervous system it will get channeled into anxiety. So say you're looking forward to dinner with your friend that you haven't seen for a long time or whatever. Some of that excitement will get channeled into anxiety and fear and worry because that's been the superhighway that you've created in your mind. So water is going to flow down the path of least resistance, and emotional charge also flows down the path of least resistance. So if you've been used to worrying for the last 5, 10, 15, 20 years, even things that are exciting will get channeled into that sort of anxious pathway. Like, oh my God, what if this happens? What ifs, worries, worst case scenarios, all that kind of stuff. And I don't actually agree with the whole excitement and anxiety are felt exactly the same way in the brain. The brain doesn't really know the difference. The brain does know the difference. There's a part of you that knows the difference between excitement and anxiety. But practically, a lot of those circuits overlap considerably. So you can kind of fool yourself into thinking, okay, well, this is just excitement, which does help. It's a cognitive reframe that does help. But again, it's really when you're feeling excitement about, that dinner that you were having with someone you haven't seen for a long time, just find the alarm in your body, put your hand over it, breathe into it, connect to it, and just kind of say, look, I've got you. I know, you're basically talking to that younger version of you. And sometimes as a neuroscientist and a medical doctor, I want to have a seizure when I start talking about the younger self or the inner child or whatever you want to call it. But so much of what I found in medicine it's been helpful, but it's not going to heal you.
Mm-hmm.
And so much of what healing is more of a spiritual connection with yourself.
Mm-hmm.
And that's what heals you. That's what provides the long-term healing.
Mm-hmm.
So it's really understanding that science can help us, absolutely, but it's going to help us cope.
Mm-hmm.
It's really connecting to your own spirit that actually helps you heal. And in a way, sometimes doing breathing exercises and mindfulness and all that kind of stuff is kind of a crutch. It's kind of a way of making you feel better in the short term. But really, if you're going to really heal this in the long term, you have to connect with all parts of you. And you have to connect your mind and your body and your adult self with your child self. That's how you heal from anxiety instead of just learning how to cope with it.
Yeah, I think you're talking about like bypassing. So it's like, I love meditation. I think that's helpful with anxiety, all that. But to a certain point, because at a certain point it can just become escaping that and trying to feel better rather than like, I need to address my inner self in these wounds and what are they saying to me and what is my inner child trying to tell me? And meditation can almost become a way of, I'm not going to listen to you. I'm just going to.
But in a way, that's the flip side of that is that meditation does teach you, okay, I don't have to give these thoughts credibility. Right. So, and I think that's a lot of, especially early in your healing from anxiety, a lot of it is the fact that you've given these thoughts, these worries, a lot of credibility. Mm-hmm. And it's like the child, you might be pregnant. Jennifer gives that a tremendous amount of credibility. Oh my God, I might be pregnant. Where Jake doesn't give it any credibility at all, doesn't affect his body at all. So it's one of those things that it's the same thought in a human being, but two very different outcomes. So you can, in meditation, you kind of learn, oh, here's a thought. I don't have to chew on it. I call it like chewing on glass is basically allowing your worries to take you over. It's like you're just chewing on glass. That's all you're doing. And you're like, why does this hurt so much? I wish this didn't hurt so much. Man, this is hurting. And you keep chewing on the glass. So it's like meditation is one of those things. It's like, oh, this is a worry. I can just let it sit there and it'll just fade. And in that practice is actually really helpful, but it's more of a pro move. It's more of a pro tip because when you start meditating, actually your anxiety can get worse because you're giving yourself this silent place to worry.
Right.
Which is basically what people do. And they don't stick with meditation because meditation becomes painful because when they stop, they just worry more because it's been such a way
it's been shut down and now it's coming to the surface, but they haven't gotten to the point of learning how to handle that and deal with that.
Yeah, because worry, I think, as a child is a way of distracting yourself. It's a way of dissociating from the pain in your body. So it actually does serve a purpose that way. But the problem is that, we're not 8 years old anymore. We're 35, 45, 55, 65 years old. And that program of worry helps me doesn't work anymore. In fact, it's making you worse. As a child, it probably did help you dissociate a little bit from the pain because you were powerless and helpless. But as an adult, it just makes everything worse.
Yeah. I think there's a point too, when you start dealing with your anxiety, where anxiety was the driving force to get things done.
Yes.
And then you may deal with that and then it's gone, but then you haven't replaced that with better motivation. And then you're like, well, how am I going to get anything done?
It's a great point, Kendall. Especially those of us with ADD. I think we use our anxiety as a way of getting shit done. And I think, you think, well, if I don't have my anxiety, I'm just going to fall to the ground and nothing's going to get done. Right. And it actually doesn't work that way. Without anxiety, you actually become much more productive and much more creative, by the way, because, one thing anxiety does is it definitely will shut down your credibility. And it's a bit of a teeter-totter too, because the most creative people I know are also the most anxious. It's it's one of those things that I think that it revs up your brain in a way that you start thinking in a different way that most people do. And I think this is the basis of stand-up comedy, is like you're basically showing, as a stand-up comedian, a different way of looking at something that you've looked at the same way for your whole life. And Seinfeld is, we were talking about that earlier. It's the whole thing about looking at things very differently. And I think that's what comedians do, is they present it in a different way. And you were talking about, the number one fear of human beings is speaking in front of an audience.
Right.
And Seinfeld talks about that. He says, the number one fear of people is speaking in front of an audience. Number two is death. Number two. So that means if you're at a funeral, you'd rather be in the casket than giving the eulogy. So that's a classic example of making something that is obvious when you think about it. It brings it into your consciousness, and the result when your brain kind of jogs it together and says, "Oh, that does make sense." Something that doesn't make sense makes sense in comedy, or something that doesn't make sense, you make it make sense. I think that's what the comedy is really all about, and that's how we do it. And I think anxious people are among the most creative when their brain kind of burns out a little bit, and the anxiety drops a little bit, and they can come into their real selves. But you're right. I think anxiety acts as a motivator in a lot of ways, and we're afraid to lose it.
Yeah. Yeah. So, I mean, it's good to have a little bit of anxiety, and keeps you alive and keeps you going. But too much is, then you shut down, and then you can't do anything. And I've been there. So I guess what do you replace the anxiety to motivation to get things done?
I think you just, you become connected to your younger self, and your younger self holds your hopes and dreams. It holds the part of you that, when you're 5 years old and you want to be a fireman, there's a part of you that really wants to be a fireman. And I think it's just really finding that younger version of you, because that's where all your best traits are. As much as you judge, abandon, blame, and shame that child in you with the inner critic, that child still holds the best parts of you. And it's finding that child, because they still have the same motivations that you do now. And they also have motivations that really actually fulfill your life rather than, hamper it. I see a lot of people who are very focused on making money, and they make a ton of money and they're still not happy because that child doesn't feel like they're connected. And, you can have all the money in the world, and if you don't feel connected to your younger self, you're not going to access your creativity. You're not going to have this sense of self-confidence. You're going to have a huge amount of imposter syndrome, and it's going to be very difficult, even if you do become successful, to really feel it and enjoy it.
Right. Yeah. Yeah. So I think sometimes when we then connect with our younger self and our creativity and our true desires and motivations, that might require a change in our life and in what we're doing or how we do it at the very least. And that can be scary to people, but like you said, that's what's actually going to be fulfilling to us in the long run. Instead of just trying to keep going with this emptiness that isn't actually fulfilling. So
yeah, and then we keep chasing it. Like I always tell people, it's like, be careful
a little bit more,
what you're good at.
And I'll be good.
Yeah, well, be careful what you're good at, because if you're intelligent, which a lot of anxious people are, they will lean on their intelligence. They will try and feel that they can think their way out of it. And basically, if worry and anxiety is a problem of excessive thinking, more thinking is not really going to help you, right? But your brain doesn't tell you that. Your brain says, we have the answer, we have the answer, we have the answer, and it just has more of the problem. So it's just really understanding, like, what do I need? What's important to me? What was important to me as a child? How can I give that child in me the connection, the love, and support now that he or she didn't get back then?
Yeah. And I think too, it's a mechanism of trying to control. Like it's all about the future. It's how can I think about things so I'll always be prepared, always be ready, I'll always be in control. But I think that when we can surrender to the unknown, and I think you talked about the spiritual, like I'm being guided, I have help, and I think God has a plan for me, and that's true freedom and true healing.
Yeah. I mean, if the thing about trauma for children is they lose faith in the world. And one of the byproducts of losing faith in the world is you start thinking, well, everything is up to me. And if you start thinking everything is up to me and you're 7 years old, that's going to be a very difficult life for you. So there is this feeling like, okay, well, I have to be worried. I have to be worried and hypervigilant about the future in order to keep myself safe, which becomes a self-fulfilling prophecy, because kids will start thinking, well, if I worry about this, I have some control over it. And of course, that's not true. But in the child mind, it is true. So we learn to become hypervigilant and worried as children as a way of, like I said earlier, distracting from the pain in our body. And it works.
Mm-hmm.
It works. So we just keep doing it. But it works as a child, but as an adult, it just makes you worse and worse and worse. So that's one of the issues of why anxiety tends to get worse as people get older.
Yeah. Yeah, that makes sense. I also think it connects to self-image. And we kind of talked about it in a roundabout way, but that I think when we start talking to our inner child and listening and feeding that is a form of self-love. And then that builds self-confidence and self-worth. And so instead of being anxious about what everyone else is thinking and how they're thinking about us and all that stuff, that helps that anxiety. And so we can be more secure in ourselves and just confident. I think that addresses like social anxiety a lot.
Oh yeah. Yeah. I mean, social anxiety, a lot of that is that we have this social engagement system in our minds and our bodies: eye contact, tone of voice, prosody of voice, body language, facial expression, how we interact with other people. Now, unfortunately, when we get anxious and we go into survival mode, that social engagement system gets shut off because we prioritize survival over connection. So if you don't have that ability to detect facial expressions or body language, or you can't make eye contact, it's going to be very difficult for you to be socially engaged. So that's one of the reasons why people have social anxiety, is because their anxiety comes up. It shuts off their ability to connect to the social engagement system. So of course you're not going to want to, you're not going to want to go and play in a softball game with your friends if you're horrible at softball. Mm-hmm. Like you're just not going to want to do it. So if you don't have the software in your brain to connect with other people, of course you're going to avoid parties and crowds and talking with people. It's just how it is. So it's basically regulating your body. And when you regulate your body, your social engagement system comes back online and you're able to read facial expressions. You're able to sort of connect with other people. So it becomes this self-fulfilling prophecy. The more afraid you are of social connection, the more it actually shuts off your ability to be socially connected. Yeah. Another unfortunate part of our human wiring. But, that's part of the game. And it's just realizing, okay, if I can regulate my body, I'll be much more able to go into that party and, maybe not feel great initially, but, see maybe one of my friends and we have a chat. And then once you've been in there for 5 or 10 minutes and you're connected, you feel okay. Mm-hmm. So it's really, it's these things aren't hard to explain from a neuroscience perspective, but they really do come down to this, internal connection with yourself as a way of healing all this stuff.
So would you say that introverts are a lot more likely to be anxious than extroverts?
Probably. I have a little problem with labels because I think people are always a combination of both. Right. So it depends. Like there's part of me that loves being seen, that loves being on stage, that loves doing stand-up comedy. And there's part of me that hates it, that just hates the attention. I don't want to be seen. I just want to hide in a corner, whatever. So, and those two drives are, of course, opposite. So, I used to have tremendous anxiety before stand-up, and I don't so much anymore, although I don't do a lot of stand-up anymore. But it's, anxiety comes when you have two different motivations that are diametrically opposed to each other. So, we want to be socially connected, but we're afraid of it. So it creates a lot of conflict within us.
Right. Yeah. I feel like sometimes extroverts, they might be so extroverted to mask their anxiety.
Oh, or their introversion. Yeah. That's why I don't like the labels too much, introvert, extrovert, because a lot of extroverts are basically doing that because they're introverted, because they found that if I'm the life of the party and that kind of stuff, I don't feel so anxious. I don't feel so alarmed. So it becomes like a learned version of extroversion. It's not really your own natural state. So that's why it's really hard to label people introverts or extroverts.
Yeah, because I can definitely... I definitely feel like there's some people that are extroverted that, I can feel they don't seem genuine. And then there's other people who are just a people person. I'm like, oh yeah, they're genuine. Yeah. So
absolutely. Totally agree with you, Kendall.
Yeah.
So I guess, it's been a great conversation. I think maybe we should kind of wrap it up a little bit with a few
Yeah.
things, and then we can kind of move on from there. I got to go visit my daughter here in a few minutes.
Oh
And,
yeah, sure. I was going to ask you, we covered a lot, and if there's
we really did. I don't want to overwhelm people.
Right. That's kind of what I do in my podcast. I cover a lot of ground, and then
you have. So we've covered a lot already.
Yeah, I really appreciate
more so
it.
than I do in most. Yeah.
Oh, awesome.
So I think that your questions have really sort of sparked sort of a kind of a flow with me. So I know I've been talking a lot, but I get excited when I get the right prompts, for sure.
Yeah, well, I appreciate that, and I mean, I love what you had to say. You had great stuff to say, so I'm just grateful to listen. So, is there any last things that you would like to impart?
I guess it's just get the book. It really is. If you struggle with anxiety, get the book. It's called Anxiety RX. It's sold like 60,000 copies. It's an audiobook as well, so I narrate that. And if you're really struggling, consider getting the program. It's relatively inexpensive. It will give you a different view of anxiety than you've ever seen before. And I just want to get as much of my work out as possible, because I think the current theory of anxiety in traditional psychiatry and psychology isn't accurate. And we're not doing people a lot of favors. I understand that, you kind of left academia, maybe at a conscious level, knowing that this really wasn't helping people.
Right.
And that's why I left medicine in a lot of ways, is I really felt that just giving prescriptions, and again, I love medical doctors. I think they're invaluable, but just giving prescriptions to hide symptoms really dangles people over the gates of hell, because they never really feel the need to go deeper, So you live kind of this superficial life in anxiety and fear, and you don't have to. If the more you understand and the more you practice connecting your mind and your body and your adult self with your child self, the more your anxiety just fades. Now, I'm not anxiety free by any means at all, but I'm a million times better than I used to be. And I also know now that I don't have to give my thoughts credibility. I think that's one of the biggest healing aspects of anxiety is you go, yeah, that's a thought, but it's not real. So it's really important to understand that there is a different view of anxiety. There's a different way of getting past it than the traditional models.
Yeah, I totally agree. I feel the same way. I'm not anxiety free, but I've come a long way, and I just notice now that when I get into patterns of anxious thought loops, that I can recognize that and snap out of that a lot faster. And I know the ways to do that than when I was younger. So it's a great journey.
Well, what you're doing is you're breaking the alarm anxiety loop, right? So what's happening in your body is there's a sense of alarm, and your mind is a compulsive, meaning-making, make-sense machine. So it makes sense of this alarm in your body by giving you things that are consistent with the alarm, which is, horrible thoughts, worries, warnings, what ifs, worst case scenarios. And if you learn like, okay, I don't actually have to pay attention to this, you can break the cycle, because the alarm energizes the worries, and the worries energize the alarm. So if you can break that cycle by just not allowing the worries to get credibility in your mind, you can actually just deal with the alarm. And once you deal with the alarm, you can metabolize that and heal the root cause of the problem, as opposed to just trying to fix your thoughts, which never works.
Yeah, that's great stuff. Well, I appreciate you coming on the podcast and sharing us with your journey and all your wisdom. It's been great.
Thanks, Kendall. I appreciate it. Anytime.